بسم الله الرحمن الرحيم.
Muslim Aid is an Australian relief and development agency. It is working for the last 25 years to help save and improve the lives of millions in over 74 countries. In Pakistan, it is working since 2003. Recent floods in Khyber Pakhtunkhwa caused utter devastation, massive loss of life, and infrastructural damages. More than 4.5 million people were severely affected, and 1,800 killed. About 1.5 million people lost their homes and became homeless. The stormy water washed away roads and bridges and damaged about 1,000 educational institutes and 169 health facilities. In this time of need, the Muslim Aid Australia launched a flood relief program with 8.5 million rupees with the help of Al Khidmat Foundation for the provision of water, food, shelter, medicine and other necessities of life in the areas of Upper and Lower Dir, Sawat, Shangla, Malakand Agency, Charsada, Nushaira and Dera Ismail Khan. In 3 months' time, it benefited about 1.6 million people in the province. Water is a source of life. The flood washed away almost all the water sources. It contaminated groundwater and caused outbreak of epidemic diseases in the flooded areas. For clean drinking water, Muslim Aid launched projects of water tanker services. It rehabilitated the household pumps and community wells and installed filtration units for safe drinking water. Under the activity of water tanker service, water tankers were hired to provide drinking water to people at their doorsteps in flooded areas of Charsada, Nushaira, Dir Lower and Dera Ismail Khan. In total, 6,095 households got benefited from this campaign. Hand pumps are one of the major sources of water in urban areas, and these were severely damaged. Muslim Aid sponsored for the rehabilitation of 400 hand pumps, 162 in the Union Councils of Charsada and 238 in Nushaira. Muslim Aid Australia sponsored for rehabilitation of 40 community wells in the villages of Dir Lower, Malakand, Nushaira and Charsada. 10,915 individuals benefited from this project. In spite of rehabilitation of water sources, safe drinking water was indeed required to avoid the contamination and the risk of diseases. Muslim Aid launched a project of installation of 100 water filtration plants in 8 worst affected districts of Khyber Pakhtunkhwa. During and after the flood victims themselves and their children were facing acute shortage of food. Muslim Aid, with the help of Al Khidmat Foundation, provided 4,000 food packages to distribute among 28,000 individuals of 7 districts of the province. Each package was enough to meet the food requirements of a middle-sized family for 2 weeks.
हम मुस्लिम एड ऑस्ट्रेलिया वाले के बहुत ज़्यादा मशहूर हैं कि उसने इस सैलाब की इस घड़ी में हमारे साथ बहुत ज़्यादा मदद की है.
Deadly flood damaged the educational infrastructure all over the province. Muslim Aid sponsored educational supplies to 25 vulnerable students in Charsada, Nushaira, and Peshawar. It also donated 5 makeshift tents for classrooms
इस्लाम के अपने हिदायत थे उसके मुताबिक हर एक
to the Shaheed Benazir Bhutto University in the district of Tirappa.
We are also establishing our offices in this Shaheed Benazir Bhutto University Shiringal Dir offer, and we are very thankful to the Muslim Aid of Australia that they communicate and they facilitate us in this disaster.
Our university was distracted by the flood. Muslim Australian Aid provided tents for us, and we continued our study here.
Flood caused waterborne diseases and posed serious health hazards to the thousands of people. It was taken seriously. Muslim Aid Australia, in partnership with Al Khidmat Foundation, organized 20 free medical camps where 9,722 patients were treated, including male, female, and children. And free medicines were distributed.
Alhamdulillah, Muslim Aid has cooperated us in the field of food distribution, water projects like installation of water filtration plants in different areas to supply clean drinking water to the people. We have been able to dig wells where there was need of drinking water. We have been able to provide them shelter in different places, particularly in the field of medical services.
The flood damaged 169 health facilities in the province. Under flood relief program, Muslim Aid supported 9 medical units and provided other necessities. These medical units continued working for 3 months and provided health facilities to 5,578 individuals in 7 districts. A well-equipped ambulance has also been imported from Japan to start functioning in Charsada.